Hey there, all you cool cats and kittens. Dr. Peterson again with Regions EMS for today's daily COVID update. Should probably come up with a different intro. We're not really doing this daily anymore. Probably going to be about twice a week moving forward. Also, I've finished The Tiger King, so if you have any suggestions on new shows that I should be binge watching, please send them to me, regionsems@healthpartners.com. As usual, information presented is current as of today. Today is Tuesday, April 21st, 2020. Things are changing, may not be current as of tomorrow, but stay tuned to our website, regionsems.com. Click on the COVID link and you'll find a whole page of resources, frequently asked questions, all kinds of guidance that you can reference, and it's time-stamped so you know that we've reviewed it recently and that you're getting the most up-to-date information. All right, let's go to the numbers. Worldwide, just about 2.5 million confirmed cases, 171,000 deaths. This Johns Hopkins coronavirus map is an excellent resource if you're interested in tracking this at all on your own. Here in the United States, just shy of 790,000 confirmed cases with about 42,000 deaths. Here in Minnesota, just about 2,500 confirmed cases, which is a gross underestimate. 143 deaths confirmed related to COVID-19. And in Wisconsin, again, tracking about double what Minnesota has been doing, about 4,500 confirmed cases with 230 confirmed deaths. Again, fortunately, we're not seeing an exponential growth. We're seeing a very linear growth. What's going to happen? You know, we have, as testing becomes more widespread and rapid, once we can start testing people quickly to determine who's infected, who needs to be quarantined immediately, who's immune potentially, especially as the antibody tests become available. And then as we start to reopen society and the economy and people start intermingling again, are we going to see another big spike? Is it going to be several waves of spikes? Is this going to linger on? Are we going to see the same number of new cases each day that we've been seeing for months? We don't know. We don't know. What we know, again, is that the PPE works. That's the best way we can protect ourselves: social distancing, hand washing, common sense, and keep doing what you're doing. As public safety, as pre-hospital, as ED healthcare workers, we are on the front lines. We are making a difference in the way that we manage our own personal safety, so we're not spreading it to other people or from patient to patient, even if we are not infected. So keep up. Doing a great job. I know it's getting long. This is getting old, but hopefully we can start to be outside a little bit more and reintegrate a little bit more with some of our friends and family members. Couple reminders or announcements for today. The ECMO team, again, is open for business. They've had a couple good saves so far during this pandemic, so keep them in mind when you have a shockable initial rhythm. Call the team early and get moving early. Talk to the doc on call. They want to talk to you to see if your patient might be eligible. Also, one development over the weekend is that Health Partners feels that they now have enough testing capacity to expand the testing options to symptomatic family members of first responders. So now, not only can you be tested if you become symptomatic, but your family members can also be tested if they become symptomatic. Because obviously that's important for us to know, because if they are infected, then you probably should stay home from work too until kind of that window passes. So that's good news, definitely a win for public safety and some of the advocacy work that we've been trying to do. Again, the same process would be in place. Call the nurse triage line. It's on the document that's posted on our website for testing of first responders, and they'll walk you through the process. Just make sure that you or your family clearly identifies as associated with the first responder community. Couple other things, just a reminder, MRCC has implemented the green, yellow, red triage color report format. So no need to give a long, lengthy MRCC report with lots of details, just the basic patient demographics, where you're headed, how long till you get there, chief complaints, and then a triage color, green, yellow, or red. Depending on the color, you may be asked some additional questions, the usual blood thinner things, GCS, that kind of stuff. But we're trying to keep the MRCC reports a little bit shorter now. They don't need all the detail. You can save that for the hospital. Just make sure they have the relevant information so that the hospital can put your patient in a correct pod or room. And then also, no need to call in the routine non-transport reports to MRCC. You can just sign those patients and clear the scene. If there's any concern, high-risk situation, please call in. We'll get you in touch with the doc to help work through the process, but there's no need to call in the routine non-transports anymore. Okay, that's all I have for today. We'll talk to you again later this week, but let's go back to our trivia questions. I found some new resources for this, so let's see what you all think. Here's today's question. Amazon, the company, Amazon.com, removed or blocked how many products for claiming to treat or cure COVID-19 or for price gouging? Was it A, 200,000 products, B, 500,000 products, or C, more than 1 million products? Send your best guess to regionsems@healthpartners.com. You can also check out our patchboard page on our COVID page. And if you don't see your agency represented, please send us a copy of your agency's patch. We'll add it to the list. Other than that, stay safe, stay healthy. We'll talk to you later this week. Have a good day.